Medical Minute is sponsored by Kaiser Permanente.
Welcome back to 11 Alive Midday. March is Colorectal Cancer Awareness Month, and doctors say this is one of the most preventable cancers, yet it's one of the leading causes of cancer deaths in the United States. So for this week's Medical Minute, we're learning more about screening, about prevention and early signs it's very important to look out for and speak up if you happen to see. This morning, we're joined by Dr. Hasib Dean, gastroenterologist with Kaiser Permanente. I'm so glad you're here. This is a really important conversation. So for people, maybe just the overview, talk us through what is colorectal cancer just to start us off.
Yeah, so first of all, thank you so much for having me. And I agree, this is a really important conversation. As you just mentioned, it's the second leading cause of cancer death in the United States. So colon cancer, in essence, is essentially a group of abnormal cells that start off in the wall of the colon, and over years, they start amassing into a tumor. And unfortunately, if they're left untreated, can turn into cancer that will go and spread across the entire body. And again, if left untreated, can eventually, unfortunately, become incurable and can lead to someone's death if we don't treat it soon enough.
Screenings are really important, and the guidelines have changed fairly recently. Talk through that for us.
Yeah, so unfortunately, there's been a shift in people who used to be older getting this cancer to people now younger getting colon cancer. So it used to be that the screening guidelines said that people age 50 started getting colon cancer screening. Now we've shifted to screening people starting at age 45. And so in an effort to get people screened earlier.
So more and more young people are being diagnosed with this disease. Why do you feel like that's happening?
The reasons we think that that's happening is one, obesity, two, the increased consumption of red meat, processed foods, foods high in sugar, sedentary lifestyle. Those are some of the risk factors that have led to colon cancer coming earlier in life.
But we talked about this being preventable, treatable if caught early. So the key is knowing what to look for. So what does each person need to be looking for to maybe have that really life-saving conversation with the doctor?
Yeah, so the good thing about colon cancer is it is truly preventable if caught really early, and it's very easy to treat if caught very early. The biggest thing is the symptoms are subtle, but look out for any abdominal pain you might be having, any sort of rectal bleeding, any sort of unusual weight loss, change in your stool habits. And don't be afraid to bring that up to your doctor. Sometimes the symptoms are subtle, but if you acknowledge them and bring it up to your doctor, you might be eligible to get screened sooner and find something like a tumor early and get it treated pretty quickly.
Dr. Dean, that's such an important point. One, these are not always comfortable conversations, but very important conversations to have. And something that might seem small may not be small at all. So better to bring it up and it be nothing than to not say something and have it be something that could have made a life-changing difference had it been a conversation you had earlier. Absolutely.
I get a lot of patients that they're really busy in their lives, they're in their 30s and 40s, and they put off a lot of these symptoms. And unfortunately, they wait so long that by the time we catch it, the tumor has progressed and it's almost at an incurable stage. But if they act early and you bring up these symptoms early to your doctor, we can find tumors that are easy to treat and makes a big difference in somebody's life.
If you had one point that you would want everybody who's watching to take away, what would that be?
Talk to your doctor about any symptoms you might be having. Bring up any family history with your doctor if you've had a parent or a sibling with colon cancer, and ask your physician if screening is right for you, and get screened, whether it's a colonoscopy or a stool-based test, when your doctor recommends it to you.
All right, and remember those subtle things like abdominal pain, change in stool. Those are the conversations really important to have. Dr. Dean, thanks so much for the time and the great information.
Yeah, thank you for having me.
Appreciate it. We'll be right back.
Medical Minute is sponsored by Kaiser Permanente.